So the reason that we're looking at passive range of motion today is that ideally a REX candidate would have good passive motion at their shoulder and their elbow, so that the device would be able to enhance their function. And in terms of manual muscle strength, we're looking for some degree of strength at the shoulder and ideally at the elbow, at least enough where the patient can move their arm around, say, if they were suspended underwater. The first movement I'd like you to do is to just try and reach straight up in front of you. Excellent, thank you. The next motion I'd like you to do is try and bring your arm out to the side. Great, okay. Would you bend your elbow and touch your shoulder? Excellent. Would you mind if I touch you? I'd like to examine your passive range of motion to see whether or not the REX would be appropriate for you. Is that okay? All right. I'm going to bring your arm straight in front of you, and I'd like you to tell me if anything is uncomfortable. I'm going to go as high as we can. Excellent. Now I'm going to bring you out to the side. The same thing. If anything is uncomfortable, you let me know. I'm going to bring you up as high as I can. Great. Next thing I'd like to do is just check your elbow motion, okay? I'm going to go from full extension to flexion. All right. Can you reach across your body towards your other hand? Excellent. What I like to do is I'd like to just try and examine that plane of motion. Okay, thank you. Another thing that we want to consider is whether a patient can bring their hand to their mouth. So Daniel, I'd like to see if you can touch your mouth with your hand. Excellent, thank you. We also like to look at hand function when we're considering the REX because the ability to hold an object factors heavily into function. And although it's not a requirement to get the REX, a good candidate should have the capacity to at least use a universal cuff or some other function-enhancing orthotic. So Daniel, I'd like you to try and pick up this toothbrush, if that's okay. Great, thanks. Okay, Daniel, I'd like to see how you can move your arm around now that you have the REX on it. So we're going to go through a few movements that we went through before, and I'd like to see how you can move your arm. Can you reach your arm straight in front of you? Great. Can you lift your arm up to the side? Great. Come down again. Can you reach across your body that way? Excellent. Come down again. Can you touch your mouth? Good. Can you touch the top of your head? Excellent.